Today we will try to understand the Stannum mat. So the Stannum mat belongs to the row 5 and the column 14. The row 5 has the features of the creativity and performance, and column 14 has the features that they are always failing in their performances because they have the sensations like they are draining. There is a constant weakness is present in them. They are not having in a state that they can perform, so much so exhaustion, always having an emptiness present in them. It is like a state where they are progressing towards losing their capacities to perform. So usually before the performances, the stand-up might always have the anxieties in them that what I will do, how I will perform, what the other peoples in the audience will think about me, that how I am performing. So that is a constant thinking in them, and due to that the state will come, finally a time will come when they are completely losing the confidence in themselves, and they always have the dread of meeting the people. They don't want to meet the people. That dread is not actually the dread, but to avoid the conversation with them because they are already exhausted, so they does not want to meet the people. And always they get a loss of self confidence in them because now they are not having ability to perform. So discouragement and despondent nature. Finally, this particular thought that I cannot perform, once it gets fixed in their mind, it is very difficult for them to get rid of. So after fixing this thought in the mind, finally they are going to develop a state of despair, very much hopelessness. And because of that hopelessness, you can say they are very much restless also, so much in a state of a discomfort that I am not now able to do anything, and even not know that what I am going to do now, what I have to do with myself. This continuously thinking is present in them that they don't know what to do now. So the main action of the sternum mat is present on the nerves, so which gets a paralytic action. That symptoms are going to be seen in the form of the GIT symptom or in the respiratory. So in the case of the GIT, there will be weakness in the peristaltic movement, which will develop the constipation in them, and the muscles surrounding the rectum and the anal canal are also so much weak that they will develop prolapse of rectum during passing of stool. And there is a constant sensation of the sinking, empty organ sensation in the stomach. In the case of respiratory, initially in the case of sternum, they have developed the neuralgia, and when that neuralgias are getting suppressed by giving the allopathic treatment or by some homeopathic medicines which are unhomeopathic for that particular patient, means that is not get a proper simillimum for the patient, so that neuralgia gets suppressed and they will develop tuberculosis in the later stage. And in the case of the respiratory, because of so much of weakness of the chest, there is a vasodilatation which leads to the congestion in the chest, and along with this there is an increase in the mucus secretion, and that mucus gets collected in the chest, which is very difficult for them to expectorate, very difficult for them to expel it out. So along with this there is an hoarseness of the voice. Along with this they are not even able to talk because of weakness of the chest, hardly they can talk, and the coughing also gets aggravated from even talking, reading aloud, or even singing, so that is present. And the nerves of the spinal cord also gets paralyzed, so that nerves which supply the extremities are also affected, so the muscles of the extremities also gets weak. So they are suppose in the case of the hands, they are not even able to properly hold the pen, not able to properly write, not able to hold a particular paper, also drop the things very easily. So it is also a remedy for typewriter's paralysis and that type of weakness in the extremity muscles. Then it is also having the action on the female organs, so there also they will develop a type of paralytic action, weakness. So menstrual irregularities are also present in the sternum female. And apart from this, they are having better always from rapid motion, continuous motion. Because of the state of the weakness, continuous motion will feel better for them, so they will feel always better when they are in a continuously rapid motion, and aggravation from gentle motion. But in the case of any pain, they always have better from hard pressure in them. And the expectoration feels better for them. So this is how there is a complete picture of great exertion of the mind and the body in the Stannum mat, and which is the debility. The debility is a very keynote of the Stannum mat. This is how the complete picture has developed.